Welcome back to Health Bulletin, where we debunk myths and bring you the latest research on important health topics. Today, we are diving into a highly relevant and controversial subject, long COVID. In particular, we will address the most common myths surrounding this mysterious syndrome that affects thousands of people. So grab a cup of tea, sit back, and let's separate fact from fiction. And then myth, long COVID is just a mild flu. Our first myth revolves around the misconception that long COVID is merely a mild flu that will eventually pass. Let me be clear, this could not be further from the truth. Long COVID encompasses a collection of persistent symptoms that extend far beyond the initial infection. Expert long COVID can cause a wide range of symptoms, including extreme fatigue, brain fog, muscle aches, and shortness of breath, among others. These symptoms can last for months, and in some cases, even after a year. Comparing it to the flu minimizes the severity and lasting impact of long COVID on individuals' lives. So if you thought long COVID is just a mild flu, think again. It's a real medical condition that demands attention and understanding. Myth, only older people get long COVID. Our next myth is that only older individuals are at risk of developing long COVID. While experts say it is true that older age groups are at a higher risk, but long COVID does not discriminate. We have seen cases across various age ranges, including young adults and even children. In fact, recent studies have shown that roughly 1 in 10 people aged 18 to 34 experience long COVID symptoms after contracting the virus. So it's crucial to recognize that anyone, regardless of age, can be affected by long COVID. This myth perpetuates a dangerous assumption that younger individuals are immune to long-term consequences. A myth. Long COVID is all in your head. One of the most harmful myths is that long COVID symptoms are purely psychological and not real. But experts says long COVID is not a figment of someone's imagination or a result of anxiety. It is a physiological condition that affects multiple organ systems, including the heart, lungs, brain, and even the vascular system. While psychological factors can influence the overall well-being of individuals, we must not nullify or minimize the physical symptoms they experience. Dismissing the reality of long COVID symptoms can lead to improper treatment and further exacerbate the suffering of those affected. It's important to acknowledge the authentic experiences of long COVID patients. Myth, vaccines cure long COVID. Moving on to our next myth, there is a misbelief that getting vaccinated will cure long COVID. According to the expert, vaccines are a crucial tool in combating the spread of COVID-19 and reducing the risk of severe illness. However, while vaccination can prevent new infections, it does not erase or instantly cure long COVID symptoms in individuals who are already affected. It's essential to separate the benefits of vaccination from the ongoing challenges faced by long COVID patients. So while vaccines are invaluable in the fight against COVID-19, they are not a magic bullet that eradicates long COVID symptoms. As we wrap up today's discussion on the most common long COVID myths, let's remember the importance of reliable information and empathy when addressing this complex condition. Long COVID is a reality that affects millions of individuals worldwide. By dispelling these myths, we can create a more informed and compassionate society that supports long COVID patients on their journey to recovery. Thanks. Stay tuned for more health news and updates, and don't forget to subscribe to our channel for the latest in medical breakthroughs and health alerts.